Time now for the live coronavirus update for San Antonio and Bexar County.
Director of San Antonio Metro Health, and we're also joined by Dr. Adriana Rocha Garcia, my colleague on the City Council from District 4. This is our COVID-19 update for the San Antonio community. Tonight we're reporting 150 new cases of COVID-19, which brings our total to 43,823 in our community. Our moving day average now over the week has dropped to 213, and that's a very good thing. We want to keep that moving in the right direction. We are unfortunately reporting 18 new deaths tonight, and these deaths occurred between June 17th and August 12th, and these are fully verified and confirmed at this point, and that brings our total to 578 of our residents lost to COVID-19. Please keep their families and their loved ones in your thoughts and in your prayers. Tonight, we are also in the hospital, continuing to trend in the right direction. We have dropped now to 651 patients tonight in the hospital with COVID-19, 62 new admissions, as well as 306 in the ICU, which is down 5 from yesterday. We're at 195 on ventilators, down 18 from yesterday. 55% of our ventilator capacity is available, as well as 16% of our hospital staffed hospital beds are available. Our hospital system remains under high stress, but it is showing signs of improvement. So remember that COVID-19 is still in our community, and we must remain vigilant. So keep up the good work of wearing masks, physical distancing, washing hands, and we will get through this pandemic. Let me turn it over to Judge Wolf.
Yeah, thank you, Mayor. And we have come a long way. We were 1,267 was our high mark in hospitals. That's back on July the 13th. So with the hard work that everybody's been doing, the masks, the social distance, sanitation, don't get in big groups, within 1 month, we've almost put that in one half, from 1,267 down to 651. Also within 1 month, we had 421 in ICU. We brought that down to 306. And we had in ventilators, we had 257 back then on July 13th, and we're down to 195. So a lot of good work in the last 30 days. We now have to continue that work because we know that we're shooting for schools to open on September the 8th, and we want to have our community in a very safe condition before we do that. So let's keep up the hard work, and let's make sure we continue to do all the things that we need to do to protect ourselves as well as our fellow citizens. I do have a new handkerchief, double-coated, quadruple up here, and I also have this. So I want to thank the census. You know, we're getting close on that, Mayor. They sent it to me today by Dwayne Robinson sent it to me. And we only have till September 30th to complete the census. We'll be knocking on doors to be sure and try to get you to sign up for it. You can also go online and complete the census at 2020 census.gov. So be sure and do that if you have the computer and the internet available in your home. And it'll only take you about 10 minutes to do it and get it done. Be sure you have your date of birth of yourself as well as anybody else in your household. And we're pleased to say that the 26 small cities of Bexar County have done a super job of getting the information out to all of their citizens. So let's keep it up. And I know the city of San Antonio has got a very aggressive program within the city, but we don't have much more time. So let's make sure we get the data in. It's going to count on how many federal funds we get, how many congressmen we get is very, very important. Thank you.
Important reminder. Thank you, Judge Wolf. And I do want to also make mention of something that we talked about a couple nights ago with regard to the augmentation task forces. We get those from the state as well as the federal government. And so I want to clarify, in the Department of Defense, we do get a U.S. Army Urban Augmentation Medical Task Force, and we do have one still present. They're based in Fort Carson, Colorado, and they are here in San Antonio at this time assisting 5 hospitals. The DoD task forces that we've received are helping in other Texas cities as well, with a concentration, of course, in the very hard-hit Rio Grande Valley. Before we get into questions tonight, I do want to introduce my colleague on the City Council who represents the Southwest side, Dr. Adriana Rocha Garcia. We've talked a lot about how this coronavirus pandemic has taken a very real toll and a heavy toll in certain families and in certain parts of town. And to discuss that and the toll it's taken on her family particularly, as well as in the area that she represents and what we're doing about that to keep our community safe, I'd like to introduce Dr. Rocha Garcia.
Thank you, Mayor, and thank you, Judge, and thank you, Dr. Guerra, for all that you're doing for our community. And yes, I am here to speak just on behalf of my personal experience. And we have, of course, in our daily lives, we have our families, we have our work families, we have our church families, and unfortunately for my family, every family has been affected. So all of my extended families have been affected. And so if you all watched yesterday on council, 6 of my cousins have passed away from COVID, and they all had underlying health conditions. But at one point, 14 of my cousins on both sides of the family were in the hospital. And a lot of them were on a ventilator. Some of them used plasma. They got plasma and they recovered. But unfortunately, we lost 6 of them. And the 6 that we lost were all on my dad's side of the family. So if you could imagine, my dad is taking it a little bit hard. He had been crying every day. And the sad part is that I couldn't even hug him because we want to make sure that he stays healthy and my mom stays healthy. So I visit them still every single day, but I'm outside 6 feet away from them. They still give me my blessing, but they don't give me my kiss that I used to get nightly. And so it's really taken a toll on families like mine, and especially in the area that I represent in the Southside community. And to that point, my extended family, my church family, has also lost some very key members of our community. And so one of them was our deacon, and he was a hospice chaplain. And it was very hard for me when I learned of that loss because he was there for everybody during their time of death. And I couldn't help but think that he had died alone during COVID. And then my faith reassured me that he was not alone. And I think that that's how I've been getting along, right, with faith and knowing that this too shall pass. But I also, I know that it's been affecting a lot of people in the South Side. And so I asked for numbers of how this was affecting. And so I also asked for a plan. And today, Dr. Bridger, thank you to her team and the Metro Health team, which is phenomenal. They have a plan in place where we're going to focus on these communities that have been hard hitting and some of the census tract communities as well. And so I asked Dr. Bridger if she could also partner with the Department of Human Services, which is out doing door-to-door outreach, and they have a goal of reaching 80% of the homes by December 2020. And she committed to that, and thank you, Dr. Bridger, for that. Thank you, Eric Walsh, for allowing that to happen as well. August the 14th, which is today, they're supposed to be working on a survey.
This briefing is continuing right now at KINS5.com and our Facebook page. Just now, we're hearing from Councilwoman Rocha Garcia on families being impacted on the South Side. And we heard personally she's had 14 family members get sick, 6 pass away. Just a glimpse at what we've seen here in San Antonio. And new tonight, 150 new cases, bringing us to a total of 43,823. The city and county reporting 18 new deaths tonight. Those occurred between June 17th and August 12th, bringing us to a total of 578 friends, family members, and lives lost here in our region. Some good news, 651 patients in the hospital. We're continuing to see those numbers move in the right direction, even though the hospital system is still under high stress, but things are improving. We're going to be right back after this break.